And welcome everybody back to the K-Mad for Peace show. I'm glad to see you come back. Don't forget to click like and subscribe. You can find me on Facebook, K-Mad for Peace group, or my webpage, www.kmadforpeace.com. Today I am welcoming cancer support community from Greater Ann Arbor, and this is Taylor. And Taylor, today I want to just say, before we get started, I've lost some loved ones and friends to cancer. And in that process, prior to them leaving, it was hard to search for community support, advocacy, or also resources. And so I just felt like it was my mission to bring to you someone from an organization that could tell you where to find some support. Although this is the Greater Ann Arbor support community, that doesn't mean there's no other community resource available for you. But today, Taylor's going to describe to us what it is that the Ann Arbor area support system offers. Welcome, Taylor.
Thank you for having me.
And nice to see you, and thank you for coming. So, Taylor, let me ask you, where are you from?
I'm actually from Jackson, Michigan, so not too far from here, about 45 minutes west.
Okay.
And I came out this way towards Ann Arbor for grad school at the University of Michigan.
Okay.
And did my field placement at Cancer Support Community.
Oh,
so
wow, that's
good
fantastic.
reason to stick around.
That's great. What's your background in the field, other than your graduating from U of M and being involved in this kind of work?
Yeah, so I do have a background in social work. I got my bachelor's in social work from Western Michigan University, and I did some work in Catholic Charities, working with homeless youth in the Kalamazoo area, and then I also did some work with communities and schools in the Kalamazoo area, providing after-school programs for youth in various elementary schools, and then really was interested in medical social work, so I decided to come on over for grad school. And I had also been personally impacted by cancer. Several family members of mine have been diagnosed and sadly passed. So the work was really interesting. And
Sorry for your loss.
Thank you.
Mm-hmm.
It was, a really good fit with what I was looking for. And I like to say they just couldn't shake me. I stayed on right after grad school, and I have been in various roles for the past 8 years.
That is fantastic. So as you can see, audience, Taylor has a lot of background, a lot of experience, and a lot to offer us. So when did you decide to embark upon this? What year and what triggered that?
So I started at Cancer Support Community in 2018, and while I was looking for field placements to be a student intern to learn more about medical social work and sort of what route I wanted to take with that, I was interested in palliative care, and this field placement was also available, a little bit different than palliative care, but still offered supportive services for patients and families. So the work was really interesting, and I had a personal connection.
That's great. So tell me, with the support education with Ann Arbor's community, where would my viewers, if they should be and so inclined to do so, find resources, and what kind of resources would they find, and do they have to apply for resources?
So at the Cancer Support Community, we offer free cancer support services to all people impacted by cancer. So not only patients, but we know that it impacts an entire family unit and a person's entire social network. Mm-hmm. So we have services available for patients, loved ones, and children, both with a diagnosis or with a parent or loved one with a diagnosis. I can tell you a little bit more about our 6 core program components.
Tell us.
And then how to get involved.
Okay.
So we offer support, which includes support groups as well as oncology counseling. All of our programs are completely free of charge. We have educational workshops where we invite experts within our community, oftentimes oncologists from Michigan Medicine, Rogel Cancer Center, as well as Trinity Health Cancer Centers, and they present on cancer-related topics. And it's also a great way to get some face time with physicians and ask more questions. We know that, those appointments are often short.
Yes,
and,
very.
You can forget all those things you want to say in that short amount of time. So that's another one of our offerings. We have social programs as well as healthy lifestyle and stress management classes. So things like yoga, tai chi, meditation, Pilates. We have a monthly nutrition and cooking class with a registered dietitian. And then we also offer practical assistance. So we have financial assistance for people impacted by cancer, where we provide grants for basic living expenses. No one should have to decide whether to pay for their life-saving treatment or putting a roof over their head.
That is really good to know.
Yeah, and then we also have lodging. So anyone traveling over 30 miles to our service area for cancer-related appointments or treatment, we will pay for their stay.
That is absolutely fantastic. Now, in doing so, does the patient have to have a referral from a social worker, or could it be a referral from a doctor, or just anybody just watching right now? Could they just call you guys up and say, hey, look, I have a loved one or it's myself, and this treatment is really costing me, and I don't know how I'm going to get to my treatments, and so do I need someone to advocate for me and give me a referral to be able to access those things?
So you do not need a referral. You can simply walk through our doors. We have our center located on Hogback Road here in Ann Arbor, not too far from here. And we have several people that will come straight from a medical appointment and say, I found this program calendar in the doctor's office, and how do I get started? You can also register right on our website for any program at any time, or just give us a call, and we'd be happy to get anyone connected to our resources. We really try to reduce any barrier of care that we can.
Can you give us your website that they would find that information? And let me just remind my audience, just because it's in this location and wherever you're watching from, seek out your community's access to services and inquire about a service like this, because I'm pretty sure it's not just this area that has it. Am I right?
That's correct. So we are a part of National Cancer Support Community. So there are several different network partners all across the U.S. and a few that are global as well. So just in Michigan, we have Cancer Support Community Greater Ann Arbor that serves most of Southeast Michigan. And then we have Gilda's Club Metro Detroit, as well as Gilda's Club Grand Rapids. And they provide the same program components that we do for cancer patients and their loved ones.
That would have been wonderful to know for my family members that have gone forward. As you know, I'd found you guys at one of the events that I had frequented just this past spring. And do you all go and visit all kinds of events where you bring about the pamphlets and the booklets that talk about the support offerings and things like that?
We do. So we have a development outreach team where we go into the communities and either do tabling events or different outreach events that we either know about or are asked to come to, and we provide our program calendars, our brochures. We'll also provide some flyers for current programs, and then like business cards so that someone can connect more one-on-one for the support that they're looking for.
Okay. So my next question is, when the patients are in the hospice stage, how far along do you all lend your support? If it's up to that point, or if it's just prior to that point, do you all have a cutoff point? I guess really is what I'm asking.
So we say that we are here for the whole family the whole time. So that is from the start of diagnosis into either survivorship or bereavement. So there is no cutoff. And if there are cancer survivors that may be attending our programs during their treatment, and their primary treatment was successful and they have no evidence of disease. We often see those people still participating in our healthy lifestyle classes for years and years and years. So
That's
there
fantastic.
is no cutoff.
Okay, that's good to know, that they don't feel that once they have that entry point that there's a certain time, and then they don't feel so ashamed that they're accessing this and feel like, okay, maybe that's enough. Because I know some that are survivors at this point, and I would like to make sure that they know that this is in existence and that they can access it. Is that at there any time have you all partnered with other organizations to maybe present an event where it not only promotes the support of whatever educational processes are involved with the cancer community organization, and also when doing so, does the event planner or person that's presenting it have to purchase the product to present, or do you offer it for free?
So we do a lot of collaborations, actually, and everything is completely free. Okay. It's not something that we would ever charge for. We want to serve as many people as we can. We know that, cancer impacts so many people, and just this year alone, it's projected that over 2 million people are going to be diagnosed with cancer, which means 2 million families. So any way that we can collaborate and really expand our service and expand our service area, we are welcoming of.
That's fantastic and good to know. Can you provide us with your website and maybe even a phone number that they could contact someone if they need to?
So our website is cancersupportannarbor.org. And our phone number here locally is 734-975-2500. We have program staff in every single day, so we can answer questions at any time.
So what's the next plan for the organization for this at this point? Is it growing exponentially, or are you just finding that everything's stable right now and what you have to offer is what you have to offer? There's nothing getting bigger? Because I know I passed by the Lodge Freeway where Henry Ford Hospital is, but across from it there's this big building being built for cancer. Is that for research, or is that hospitalization? Do you know anything about it, or do you know what that entails, if at all, information that you could provide?
I'm not sure of that one. It, to my knowledge, does not have any cancer support services. We know that traditionally medical care kind of leaves out this psychosocial piece and treating a whole person, not just somebody's cancer diagnosis. So unfortunately, we are not involved in that. But we are looking to grow every single year. So we actually opened our doors in 2007.
Oh, that's fantastic. I didn't know that.
Yeah, and at that time, from 2007 to 2008, we had served about 180 unique individuals. And today we're serving about 1,400 unique individuals. And part of our strategic planning every year is to grow by 10% and meet more needs. So we have offered a variety of different platforms for services. So that includes both a virtual, in-person, and hybrid, where we offer both in-person and virtual for a program. So we're able to expand our reach outside of just our service area. We have people zooming into programs from all throughout Michigan.
So I know that there are a variety of cancers and a variety of fights that are going on, and some people are in remission, and some people have the certain things removed. How would a patient call your services and say, I need to be fitted for a bra, or I need to be fitted for a wig? And how does that connect with those services that the insurance may pay for, but the insurance says you need a referral, or you need to have done these steps first before we get to this, and we'll pay for that service? And that occurs and they get denied. How do they reach you for that? Well, I should say, how would they ask for that service in your support organization and say, I need that help? How does that come across?
Yeah, so that is actually not one of our core services. However, we do a lot of resource referrals within our community. So we get a ton of calls about these types of things, and we often refer them to the Wig Bank at Michigan Medicine, or Trinity Health has In Spirit Salon, where you can get fitted for a wig and also prosthetics if you need fitted for maybe a mastectomy bra or something like that. They can help you with that. And provide you with all of the assistance if your insurance does not cover it.
That is really great to know, and that seems for me to hear that lets off a lot of stress and a lot of things that, and some people go in for surgery, they're in remission, and they're afraid to even come out. Their anxiety levels are high, and these are because I had friends that this has happened to, and I just felt so helpless, like I don't know where to look for you. And when I did, I came across organizations that supported even getting them a new boiler, a new hot water tank in their house, a roof repair, and those kinds of things. But I often looked for organizations like yourself and your organization to kind of close that gap, so that would be less of a challenge when you're on the phone and you have to kind of re-explain all of these things and the steps and the things that you've gone through. And then I could see the stress on my family members and friends' faces as they navigated through this pool of phone calls, questions, repeating the story, and I hurt for them. But I'm so grateful that you took the time out today, and I really appreciate you sharing this information, and I'm so glad that these opportunities and things that you all are collaborating with other organizations are closing that gap, and it's going to make a lot easier time for our members that are suffering to be able to access those things. Is there something that you'd like to leave us with today that would impact them understanding that care is there, and to get them to understand that it's not just a phone call they make, but it's actually an organization that is really looking out to support them?
Yeah, I will say that everyone that walks through our doors or registers for something on our website, we call them all individually. We want them to know that, you're not just a person that's walking through our door and then walking back out. We really do care about the services that we're providing and making sure that they're getting the services that they want and need. So anything that we can do to help, close that gap, like you mentioned, we were absolutely striving to do.
Okay, so can you give us an address for Hogback Road?
Yes, we are located at 2010 Hogback Road, and we are in Suite 3, and that is in Ann Arbor.
And they can ask for anybody?
Yep, you can come right in. We do not have a traditional setup. It's not like walking into a doctor's office or a medical center. We have big comfy couches and a full functioning kitchen with coffee and tea and snacks. And oftentimes you'll see people, in there with their feet kicked up, a blanket on. Sometimes they'll take their wigs off. It's a very comfortable space, and we always want to make sure that is presented that way, and it's a home away from home.
One more thing. If you have someone that is a patient and going through some things, and they're afraid to come out of their house, or they're afraid to, is there some kind of way, like say a family member came in to advocate for them because of their anxiety level, to have to come out and ask for support? Is that an open door policy? Is that okay?
Absolutely, and that is something that we see for various reasons. Like you said, it's, calling sometimes is just one more thing on top of trying to manage somebody's medical care or their own medical care, and it can be completely exhausting. So we get calls and people walking in all the time to advocate and ask questions on behalf of their loved ones. And that's why we have the virtual programming. If you don't want to come to us, we can come right to your home on a mobile device.
Tell us how they can get in touch with being on that virtual side. How can they access that? Do they need to call you and you give them a Zoom connection, or do they call and you say, well, on these days we have something going on the website, log in and you can participate? How does that work?
Yes, so we provide all of our virtual programming on Zoom. So
Okay.
all you have to do is give us a call or go on our website and register for the program that you're looking for. And the email that you provide will send a link right to. You just click on it and you are all set to join.
See how easy that is. And here you go. A closed mouth does not get fed. And now you heard it from me, okay? And I'm so glad, Taylor, that you came, and I really appreciate everything that you had to offer. Let me make sure that I got everything that I wanted. And we did ask for the advice. I want you guys to make sure that everything that Taylor just said, take that to heart. That's nothing that we are just talking about and just in general, we're just trying to be on here just to have some fun. But this is actual information that you can get. And they have support pamphlets. Taylor, can you hold up your magazine and tell them what that is? And I'm going to leave you for that.
So this is our quarterly program calendar. This comes out new every quarter, and it has all of our current programming. So right now we have about 115 programs a month. So there are a lot to choose from, and they are all listed in here. So anything that you are interested in, and a lot of these programs are drop-in. So you could register for a yoga class and come to all 7 for the week, or come once a month. It's really up to you on how you want to participate, but they're all listed in here as well as our contact information.
Before I leave, I have another question. Sometimes we forget the kids, and they're wondering like, what's going on? And why is everybody acting so weird? What services are provided for the children of those patients that when they have to come and maybe they have to bring their children along? Do you have anything for them?
Yes, I'm so glad you asked. We have several programs for kids, actually. So we have a support series called Kid Support, and that's when a family will come in as a unit, and then we break them up by developmental stage. So we'll have a parent group, and then depending on who's participating, we might have a teen group, and then maybe an upper elementary and a lower elementary group. And it is play therapy to help children understand how cancer is impacting their family and how they can communicate about that.
That's fantastic. Do you guys have petting zoo opportunities, or come in and the pets will make you feel better if you just pet them?
We've actually had some dog therapy social programs.
Okay.
So not necessarily all pets, but some. We've had service dogs at our center several times.
Okay.
And that's part of our social component.
That sounds fun. I like that. I'm an animal person, so yeah. That's
Hopefully
why
a dog person.
Yeah, I am. I have 2 of them. I want to thank you guys for listening, and really, don't be afraid to take the opportunities that are out here that are free of charge. Don't be afraid to ask questions. Don't be afraid, if you can't do it, to send a loved one to get what you need. Don't sit alone with this. Sometimes in the process of grieving your own situation, you can lose sight that there are people out here that do care. So don't forget, K-Mad for Peace is talking to Taylor right here. And there is a support and education group waiting for you to get involved. And I want to thank you all for joining us. Until the next time, a closed mouth doesn't get fed. Peace.